Recording. Great, perfect. All right. So let's get started. I'm going to share my screen with you guys and we'll get started. I know everybody is busy and they just want to they have a limited time. So we'll get started. So I just want to make sure that you're seeing my perfect. So you're seeing my screen. Okay, great. All right. So today we are talking about transforming your health after 40, the first steps to managing a chronic disease naturally. So basically, we're going to be talking about how do we manage chronic inflammation and insulin resistance. This is at the basis of a lot of chronic diseases. So we need to manage that to make sure that we improve our condition. So hello, everybody, and thank you for joining me. My name is Alexandra Santamaria. I am the founder of RX Health and Wellness. I am deeply committed to empowering women over 40 through innovative health strategies based on functional medicine principles. Today, we'll explore how to manage and reverse common health challenges like chronic inflammation and insulin resistance, which are associated with a ton of chronic diseases. Diseases like type 2 diabetes, like PCOS, like cardiovascular disease, like NASH, which is non-alcoholic fatty liver disease, obesity, metabolic syndrome, Alzheimer's, some dementias, some cancers, ovarian, breast cancer, pancreatic and liver cancers. They're all associated with insulin resistance and chronic inflammation. Okay, so by the end of this workshop, I hope you'll get an insight on how your body changes after 40 and why we have dedicated our space and at RX Health and Wellness to women over 40. Understand the impact of chronic inflammation and insulin resistance and increasing your risk for chronic diseases. And once you have that diagnosis, how it can actually make your chronic disease, whatever it is, type 2 diabetes and so on, worse. So we'll learn actionable tips to enhance your well-being through nutrition and stress management. So as we age, our bodies undergo significant changes that can affect our overall health. One of the most impactful changes is hormonal shifts. So for women over 40, this includes the onset of perimenopause, somewhere in your 40s. They say you go into perimenopause at least 12 to 13 years before you actually go through menopause. So this leads to fluctuations in hormonal levels, particularly estrogen and progesterone. These hormonal changes can affect a wide range of body systems, leading to symptoms like hot flashes, sleep disturbance, mood swings, and changes in your metabolism. Another aspect of aging is that your metabolism slows down. So as we age, our metabolism naturally slows down, which means our body uses fewer calories to function the way it did before when we were younger. It also means that a lot of time we're losing muscle mass and replacing it with fat. So this slows down, can contribute to weight gain, make it harder for you to lose weight, and it also impacts how our body processes sugars, fats, and can increase the risk for things like type 2 diabetes and cardiovascular disease. So We are, RS Health and Wellness will be focusing a lot on type 2 diabetes in the coming months because we're going to be launching an arm to our membership that has to do with type 2 diabetes and how to manage it and even possibly put it into remission. So type 2 diabetes become a more significant concern as we age, primarily due to increased insulin resistance and impaired pancreatic function. These changes mean that your body can use insulin effectively to move sugar from the blood into the cells to be used for energy, and leads to those high sugar levels in your bloodstream, which can cause a range of complications if you're not managing your blood sugars well. Cardiovascular disease are also prevalent as we age, and your risk factor starts going up before menopause, but it really peaks after menopause. So changes in heart and blood vessels, increase arterial stiffness and accumulation of fatty deposits inside the blood vessels that can contribute to cardiovascular disease, things like stroke, heart attacks, but things as mild as high blood pressure and dyslipidemia. These problems are, or high cholesterol, I should say. These problems are exacerbated as we age, and they can lead again to changes that will make it put you at a higher risk for these cardiovascular disease. So as you grow old, by understanding these changes, it's essential for you to recognize the symptoms, the risk associated with aging, but also implementing proactive management strategies. And you can understand that if that's what's going on for somebody who has no diagnosis of chronic diseases, for someone who has a chronic disease, your chronic disease can exacerbate your symptoms of menopause or perimenopause, but perimenopause itself can also exacerbate your chronic disease. So by adjusting our lifestyle choices, such as diet, exercise, and stress management, we can sort of, for those who don't have the diagnosis, decrease your risk, so mitigate some of those risk factors, and also decrease your symptoms of perimenopause. For somebody who has chronic disease, same thing, decrease any symptoms that come with perimenopause, but also mitigate any increased risks that come with both having a chronic disease and perimenopause. So this approach is crucial for preventing chronic disease and enhancing the quality of your life during the later years. Okay, so chronic inflammation and insulin resistance are closely intertwined. That they significantly impact your health, and especially as we age. These conditions are not only prevalent, but also they exacerbate each other, leading to a cycle that can increase risk of numerous health issues and numerous chronic diseases, including type 2 diabetes, cardiovascular disease, and even some autoimmune disorders. Chronic inflammation is a prolonged inflammatory response that can affect the body in detrimental ways. Unlike the acute inflammation that we all know, which is your body's healthy response to injury or infection, chronic inflammation can be silent damage to the tissues over time without you having obvious symptoms. This type of inflammation is often driven by factors such as poor diet, lack of exercise, stress, and exposure to toxins. Chronic inflammation is linked to accelerated aging and is a contributor to several diseases of aging and a lot of the diseases that I already mentioned. Insulin resistance occurs when the cell in the muscles, in the fat, in the liver don't respond well to insulin and can't easily take that sugar molecule or glucose from the blood into the cell to be used for energy. As a result, your pancreas will try to make more and more insulin. So you actually have a state of hyperinsulination to help drive that sugar molecule into the cell, but your cell is not responding. So the cells are just not listening to insulin. So insulin is like a key to open the door for the sugars to go in, but the cell, the key doesn't fit that insulin cell anymore, kind of like that. So the excess insulin might lower your sugars temporarily, but can also lead to more severe health problems, including type 2 diabetes and heart disease. Factors that contribute to insulin resistance include genetic elements. So if somebody in your family had type 2 diabetes, for example, you're at higher risk, but it's not the only thing. A lot of lifestyle elements is what will bring that insulin resistance to the front. Excess weight, especially around the waist, and physical inactivity. So those are the main things for insulin resistance. All right, so functional medicine addresses these issues holistically by focusing in identifying what the root cause of this disease are, merely than just treating the symptoms, which is what the standard medical practice is. So this approach typically involves a comprehensive evaluation of the patient's detailed history, lifestyle, and environmental factors. So they look at your dietary intake. So they will implement an anti-inflammatory diet rich in antioxidants, fibers, and omega-3. They may use something like the elimination diet to make sure they remove any food sensitivities. They will give you foods like berries and fatty fish, leafy greens, and nuts, which are the staple of the anti-inflammatory diet. And they will suggest regular physical exercise because it's a powerful tool in reducing insulin resistance. And it will help, of course, with metabolism and reduce fatty acids in the blood and enhance your overall fitness. Stress reduction. So chronic diseases and chronic stress can trigger and exacerbate chronic inflammation. And chronic inflammation can exacerbate and make these chronic diseases worse. So techniques such as yoga, mindfulness, and meditation can be used to decrease your stress. We also use some supplements, including omega-3 fatty acids, magnesium, and curcumin, that have shown that they can reduce inflammation and support insulin resistance. Sleep optimization. Quality sleep is crucial for regulating your hormones and reducing inflammation. It can boost your immune system, and it can just help your body repair and any damage that has gone on during the day. So sleep is quite important. All right, so focusing on the whole person is a comprehensive approach that addresses the individual's overall health by considering multiple factors that contribute to well-being. This approach moves beyond just treating solely the symptoms again. We looked at physical, emotional, environmental, and lifestyle elements that can influence your health. By considering everything from nutrition to stress levels, we aim to balance the body's natural system and address complex health issues like chronic diseases that have chronic inflammation and insulin resistance. So basically what I'm saying is your body has everything it needs to repair itself and to get you back to a healthier state. We just need to figure out what's missing, what's deficient, what's sensitive in your body. Gut microbiome is very, very important to your health. So figuring how to optimize your gut microbiome. We do all of that with nutritional intake, physical activity, decreasing stress, better quality of sleep. We take into account environmental factors because exposure to toxins and pollutants in the environment can impact your health. We evaluate environmental exposures and provide strategies to reduce their impact, such as detoxification and choosing organic products and avoiding known contaminants. We also focus a lot on your emotional and psychological well-being. Mindset is probably one of the biggest things for your health that you can work on. Because if you believe that you can improve your health, or whether you believe that you cannot improve your health, you are correct. So mental health is an intrinsic part of your physical health, and your physical health is an intrinsic part of your mental health. They're very interconnected. Functional medicine often works with patients to improve their mental well-being through counseling, support groups, therapies such as that, by fostering positive mindset and emotional resilience. So we look at the whole person. Incorporating anti-inflammatory foods into your diet is critical in reducing that chronic inflammation and supporting your overall health. So chronic inflammation is linked to many diseases, including arthritis, heart disease, and diabetes. By choosing foods that are rich in anti-inflammatory properties, you can mitigate the impact that these conditions impact this condition. So enhance your body's ability to recover and maintain health. So omega-3 fatty acids, we like you to consume more fatty fish like salmon, mackerel, sardines, and trout, which are excellent sources of EPA and DHA. But just have to be careful with the source again, because there's a lot of mercury that comes with the fish. So make sure that you're choosing wild sources and not farm fisheries. Flax seeds, chia seeds, and walnuts, they all contain ALA, a type of omega-3 fatty acids that can be partially converted again into EPA and DHA. So if you can't consume fatty fish like me, I am allergic to fish, then consuming flax seeds, chia seeds, and walnuts is really important. It can help you. You can also supplement with fish oil or algae supplements. Again, the source of where your supplements come is very important. Leafy greens. So we like you to consume a lot of leafy greens, which are rich in antioxidants and vitamins, and they can protect you from further inflammation. They're great sources of fiber. They have a lot of vitamin C, and they can reduce that C-reactive protein, which is a marker of inflammation. So spinach, kale, Swiss chard, these greens are loaded with vitamin A, C, and E, and vitamin K again, and minerals like magnesium and calcium. So they're great not only to protect you and reduce that chronic inflammation, but they can actually boost your immune system and protect you from getting sick. Broccoli is rich in anti-inflammatory and antioxidant properties, which include key phytonutrients like sulforaphane, which have been shown to be an important ingredient to reduce inflammation. So nuts are a great source again of fats, but they also contain antioxidants. So almonds are high in vitamin E, and they can protect the body from inflammation. Walnuts are rich in ALA, and the plant-based omega-3 fatty acid comes usually from walnuts, which can help fight inflammation. Other anti-inflammatory foods would be like ginger and turmeric. Both are renowned for anti-inflammatory properties. Turmeric contains curcumin, a compound that is a very strong anti-inflammatory and antioxidant agent. Ginger, it inhibits pro-inflammatory molecules. Berries like strawberries, blueberries, raspberries, and blackberries are rich in flavonoids, which have antioxidant properties and can also help reduce inflammation. Extra virgin oil contains oleocanthal, which has the properties similar to a non-steroidal inflammatory or NSAID like ibuprofen, Motrin, and the like. It helps reduce inflammation markers such as C protein reactors. Okay. Managing insulin resistance through diet is a key strategy. I'm so hot. Preventing and controlling conditions like type 2 diabetes and metabolic syndrome. Insulin resistance occurs when the cell, again, cannot respond to that insulin, leaving the sugar or glucose in your bloodstream, so your sugars go up in your blood. This can lead to a significant impact on your health and can come with a lot of complications. So what can we do? So we know high fiber intake, it plays a crucial role in managing your insulin resistance. So we don't believe that carbohydrates are bad for you. We just want to make sure that you're choosing more of the non-starchy carbohydrates over the starchy carbohydrates. And a lot of the starchy carbohydrates are ultra-processed foods that you shouldn't be consuming. So high foods are also good for promoting fullness. It can help with weight management and improve insulin sensitivity. So legumes like beans, lentils, and chickpeas are a good source of fiber. Whole grains, quinoa, barley, oats, and whole wheat. Again, make sure you're looking where your foods are coming from, and make sure they don't have a lot of insecticides and toxins that are not going to be good for you. Vegetables and fruits, leafy greens, berries, we talk about, apples and other high fiber fruits and vegetables. For patients with diabetes type 2, when your sugars are not well controlled, you just have to be careful with the amount of fruits that you ingest. Once your sugars are better controlled, you can eat fruits with no concerns. Low processed sugar intake, reducing intake of processed sugar and refined carbohydrates is really, really imperative in managing insulin resistance. These foods can quickly increase your blood sugar and insulin levels, which can again exacerbate your insulin resistance. So every time your sugars go up, your insulin resistance goes up. So sugary snacks and beverages are things that you should avoid. Avoid sodas, candy, desserts that are high in added sugars. Am I saying you can never eat these foods? No, but I would not eat them frequently. I would just reserve them for very special occasions. Refined grains, minimize consumption of white bread, pastries, and other refined grains products again. Lean proteins are important. Overall, we would like you to reduce red meat. We would like you to have more protein coming from plant base, but I'm not saying that you cannot eat meat. So just again, look at the sources of your proteins, but poultry like chicken and turkey without skin is perfect. Fish, again, we talked about sources of fish and mercury. Plant-based proteins such as tofu, tempeh, and seitan are good sources. Healthy fats like nuts and almonds, um, flax seeds and chia seeds. Avocado are rich in monosaturated fats and fiber, so they're a great superfood. Olive oil, extra virgin olive oil. So for most people who have chronic disease, chronic inflammation, and some insulin resistance, then having fats, healthy fats, is a great thing. Patients with type 2 diabetes have to be a little bit more careful just because they are high calorie, and they also need to be careful with the amount of fats, but in cardiovascular disease patients as well. But having fats is good fats is important to have them in your diet. So by focusing on a balanced diet, that's what's going to manage your insulin resistance. Okay. Boosting your metabolism naturally involves lifestyle habits again. So diet, exercise, and other healthy practices. Regular exercise activity. So this is one of the best ways to reduce insulin resistance along with weight loss. So engaging in regular physical exercise, one of the most effective ways to boost your metabolism. Exercise not only burns calories, but also builds muscle, which we're all losing after 40. If you incorporate a mixture of aerobic exercises with other types of exercises, increases your heart rate and improve your cardiovascular health overall. But you should incorporate not only aerobic exercises, but also health, strength training, and flexibility in your exercise. Adequate hydration. Water is an exceptional key component of metabolism. It helps transport nutrients to the cell. It supports digestive health. It can aid in burning fat. So drinking enough water throughout the day can help fill you up, first of all, so you're not always feeling hungry, but also prevents overeating. Additionally, cold water may provide a slightly boost to your metabolism as the body uses energy to heat up the body temperature. So nutrient-dense foods, again, you want foods that are going to support your thyroid function. The thyroid gland plays a crucial part in regulating your metabolism. So foods that are rich in iodine, selenium, and zinc, such as seaweed, eggs, and Brazil nuts, can support a healthy thyroid function. Foods that enhance energy levels, such as high in iron, such as lean meats, beans, spinach, can boost your energy levels and your metabolism by enhancing the production of red blood cells, which are the ones that transport oxygen to the tissues. Spices. Some studies suggest that spicy food can temporarily increase your metabolism. Ingredients like chili peppers contain capsaicin, which might also give you a slightly boost to your metabolic rate. Okay, effective stress management is crucial for maintaining overall health, can significantly impact physiological processes like insulin sensitivity and chronic inflammation. So chronic stress can trigger your body stress response system, leading to elevated cortisol levels, which may exacerbate, again, your insulin resistance and promote chronic inflammation. So integrating daily stress management techniques into your routine can help mitigate the effects and enhance your body's ability to function better. So mindfulness, for example, mindfulness involves staying present and fully engaged in the moment without judgment. Practicing mindfulness throughout the day, and you can even do a mindfulness meditation will reduce stress and improve your overall emotional well-being. Regular mindfulness meditations have been shown to decrease production of stress hormones such as that cortisol, lower inflammation, and improve insulin sensitivity. Yoga. Yoga combines physical postures, breath control, and meditation to enhance, again, physical and physical and mental well-being. So regular yoga practice is known to be effective in reducing stress and anxiety. So it can help you manage insulin sensitivity and decrease chronic inflammation. Overall, regular exercise is a potent stress reliever. So it helps reduce your body stress hormones such as adrenaline and cortisol, and it helps produce more endorphins, which are chemicals that you're in the brain that are the body's like natural painkillers and mood elevators. Deep breath techniques can activate the body's relaxation response, counteracting the harmful effects of stress. So there are different techniques. There's the box breathing, where you breathe in for 4, hold for 4, breathe out for 4, and then hold for 4 again. There's also the breathing technique 4, 7, and 8. So you take a breath on 4 counts, you hold it for 7 counts, and then you breathe out for 8 counts. So adequate sleep. I think sleep is underrated. It's one of the critical elements for stress management, but also for immunity and for just overall health. So lack of sleep can exacerbate your stress levels, create mood imbalances, create hormonal imbalances. It can impair your cognitive function, so makes you foggy. So making sure that you're getting a good night's rest is really, really important for your overall health. Okay, so making time for these activities is important. Sometimes we need to schedule them into our weekly schedule so that we know that we are going to be practicing. So schedule those techniques and keep that appointment with yourself. All right, consistent managing stress is crucial for well-being, right? It will not only decrease chronic inflammation and improve metabolic functions, decrease insulin sensitivity, and prevent a whole range of chronic diseases and enhance your overall health if you already have a chronic disease. So chronic inflammation, we know that by managing our stress, we decrease increasing chronic inflammation, improve metabolism. Again, it affects your body's processes of how to process blood sugars and decrease insulin resistance and mental health overall. It can lead to decrease in symptoms for anxiety and depression and so much more. So it can also boost your immune function. Stress can weaken your immune system, making it more susceptible to infections and illnesses. So regular managing of your stress will improve your immune system, improve your body's ability to fight off illnesses, and improve sleep, right? So why are we doing all this? Because we want as people with chronic diseases, as people with type 2 diabetes, with arthritis, with cardiovascular disease, with PCOS, we are looking for quality of life, right? So we want to not only manage our diseases well and reduce chronic inflammation, reduce insulin resistance, because we want to prevent further complications or other disease states that come along with it. We want to have a higher quality of life. We want to be able to sleep through the night, boost our energy levels, and improve our overall emotional and physical well-being. We want to be able to live our lives and do the things that we want and not be confined and unable to do these because of chronic disease. So, for those of you who are interested, I know information is everywhere nowadays. I would just say be careful where your information comes from. Implementing some of these techniques and keeping focus on these things is sometimes a little hard when we have so much going through on our daily lives, job, family, kids, maybe taking care of your parents, your mother. It just leaves very little time for our self-care. And as such, we have, and especially as women, we have a hard time taking care of ourselves. But just like in the plane, we need to put on our oxygen mask first, and so that we can take care of everyone else. If you're sick and you can't take care of them, then what's going to happen, right? So RX Health and Wellness focuses on help you implement all these things. We have created a membership called Empower Wellness, and it's focused on decreasing chronic inflammation and decreasing insulin resistance. We are in the process of launching our founding membership. We'll open our doors on May 16th through the 20th. We are offering a very low rate of $17 per month. And our founding members will lock that price per life. And even more excited is that while we know what you need to do and what we need you to take care of to get healthy, and we can help you with information, with coaching. We can form a great community that will foster transformational buddies that will be there for you, people that are going to be helping you along the way. We just need a little input from you guys that will help us streamline the membership and make it something that is truly, truly important to you and that will benefit the most the members. So if you are up for being one of our founding members, I envision a community full of women who are helping each other, who are cheering each other on, who are there for accountability if you need it, so transformational buddies, or if you just need someone to be your sounding board or somebody to cheer you on, that's where we're going to come in. So if you'd like to know more, please go to our website, rxhealthandwellness.com. We are going to provide you with resources, with education, information, coaching, to help you get your health under control and improve your overall health and maybe even put your condition into remission. So we're here to be there with you along that health journey every step of the way. We focus on small steps, micro goals to get your going and start seeing results right away and start feeling better. So if this sounds like something that you would like to be part of, please visit us at rxhealthandwellness.com. Again, our doors will be open from May 16th to the 20th. And we would love to have a group of women who will help shape this membership and make a great community where other women can come in and be part of. We would want to be your tribe. We want to be there for you as much as we can. In the future, we're looking forward to having an arm of this membership be all about diabetes. So if you join now as a founding member, once we launch our diabetes focused membership of the Empower Wellness, you will automatically have access to everything that will be included in the diabetes type 2 solution membership, the arm of Empower Wellness, if you become a founding membership now. So I hope that if you have any questions or any concerns, that you let me know. Okay, so I love to answer any questions you have. Let me see if we have any questions either on Zoom or on the Facebook. So if you want to just put your questions in the comments box on Facebook or in Zoom, I will take a look. Just wait a couple minutes. So if you, for any reason, are not, we're not able to answer your questions, or you think of a question after the presentation, please feel free to send us an email to support@rxhealthandwellness.com. You can also visit our website at rxhealthandwellness.com. There's tons of information on our blog about chronic diseases, chronic inflammation, chronic, insulin resistance, on what to eat, what not to eat, exercise, everything that we've covered today. You can also send us a DM through either Facebook page or Instagram if you have any questions. I don't see any questions neither on Zoom nor on Facebook page. All right, well, I hope you guys take advantage of that PDF summary that we put out for you guys. If you have questions, again, let us know. If you're interested in our membership, our founding membership will be, again, the doors will open on May 16th through the 20th. And you just need to go to that website, rxhealthandwellness.com, and go click under memberships. You'll see the founding membership launch. I hope you guys have a great rest of the day, the rest of the week. I don't see any comments right now, so you can also always put a comment under this presentation, and we'll be sure to answer any questions that you may have. Again, information is important. And if you don't have information, then you can't act upon it. So information is power, and that will let you know what you need to do. But it's not power if you don't take action on it. So taking action on any new information is where power comes from. So take what you learned today, maybe one or two different things, and take action on it. Remember, whatever you focus on, that's where energy flows, and what you keep focus on will improve. So have a great rest of the day, guys, and I will see you at another workshop. Take care. Bye-bye.